We're now looking at the specialized units. I'm just going to give you an example of what I'm talking about. So say you've folded this leg and you found that the femoral nerve is still catching, which then experiences a pain in the lower back. We then work the hamstrings to loosen that up and we retest it. So you can apply some oil or whatever it is that you use as a medium, apply it to the leg, and you can use whatever techniques that you're used to, right? So if you're with sports massage or you're in remedial massage, then you can use these areas by doing some light cross fibers or medials or laterals, and you work them. Or you can just use some deep longitudinal movements, and if you feel any little bubbles or little gases in there, then you may need to make sure that all those gases escape, so that allows the muscle to be a lot more flexible and looser. So you work these areas. You can also work with your elbows to loosen these up. There's no set movements. You may want a bit more flexibility, so you bend the legs a little bit more, work these areas. And once you've done that for a few minutes, you then retest it. I wouldn't go any longer than a minute or two, or maybe less, because you don't need that much excessive amount of work on the legs. What you want to do is that you're working on the actual special points that actually affect it, not just doing it for general rub. Unless, of course, you have a lot of time on your hands and the person's free, then you can just play with the legs. So you test that. Now, if that's still playing and you've worked on that at a certain pace, and it's still catching in that area, still tightness, you may want to go a little bit deeper into the leg. So you press a little bit deeper and you work in those. Once again, don't invalidate the body, you just move your body weight and you work the muscles. And you feel them give and take underneath you. Okay, so they're the specific points that we talk about for that. With the neck area, you can use what you've learned in Swedish massage to allow that to be loosened up. But once again, you want to retest to see if it's flexible. Now, if it's sort of still caught in that area, it could be to do with the deltoid muscle you need to work on. It could be the triceps. And as I said, doing that work here, you may only do 5 or 6 seconds, pressing on that and then retesting it. And then know that you're actually on that spot. You don't want to be working on this area here too long and know that you're not getting anywhere. So you want to test referred local muscle and nerve areas first to allow you to know where you're going. So they're the specialized movements that we're talking about. Now, if they've got a shoulder pain up here or a neck pain, sometimes it'll even be on the gluteus maximus that you need to work on, or the gastrocnemius that you need to work on. And then once again, 10, 15, 20 seconds on the pressure points, extension, lateral medial movements, and retest the neck again to see if there's any results. So that way you're working from head to toe with the body rather than just one part of the body. You work the neck because it's sore. You try and be a detective and work around, which is what I like about the musculoskeletal alignment. It's actually a very progressive work, and if you want to add things in and take away, it's up to you. Now that you've tested the whole body, that means that you check for the femoral nerve, you check the ankle joint, you check the shoulder joint, you check the knee neck, now the neck joint, and you're happy that everything is functioning efficiently. You've done the abductor, the adductors, you've done the hip flexors. You're happy. Now we get to turn the body over. Turning the body over, we then make them nice and comfortable, of course. Bring that head down. We then work on the legs of the body first, okay? Now, we do a dorsiflexion movement, like so, which is what you learn in Swedish massage, in the Australian College of Natural Health part. Then the plantar flexion, just to check everything is, inversion, eversion. Once you find that's comfortable, then we look at working on the abductor adductor muscles by stretching out the hips. So we do the folding, stance and posture again, and then work along the quads, then along the gracis and sartorius muscle in the inner leg, just pressuring down, also along the calves. You go from toe to ankle, work along the quads, pressing in that way. Stances are important as you're leaning into the body. Work the inner thighs. 2 movements. If the leg's a lot bigger, you can do 3. And along the calf area, like so. And you work your way up to the knee, same movements again. Posture, you're leaning on the body. Make sure your breathing's good. Stretching the center of the body. Yeah, slip there, along here. And then you work your way up to here. Next thing you do then, once you've done all that, you then stretch the muscle over this way. You put the leg across if they're able to. And then you stretch their body across there. Bring that arm across this way. Get them to breathe in. And as they breathe out, you just stretch the body. Nice and gentle. From here, once again, you do the same thing. And then back down. Then you press this forward. And then back down. Just like so. Then you repeat on the other side.